Ladies and gentlemen, it is a great honor and pleasure to welcome you to the College of Medicine and Pharmacy of Agadir for the first International Masterclass of Andrology. This event is organized by the Association of Departments of Urology of the Souss Massa University Hospital in collaboration with the Global Andrology Forum, GAF, and the Association of the Urologists of the South AUS. And we are deeply grateful for the presence of esteemed experts from various countries. We appreciate their time and efforts in preparing this masterclass, ensuring the delivery of high-quality content focused on practical issues in male infertility and male sexual disorders that clinicians may encounter. A warm welcome to Professor Agarwal, founder and director of the Global Andrology Forum and the most cited author in the field of male infertility. We also extend our welcome to our panel of experts, Professor Giovanni Volpi, Dr. Castiglione, Professor German Ingera, and Professor Sirahatin Sayan, all of whom have extensive experience in andrology. And also Professor Konstantinidis from Greece, who will be joining us in the next few hours. We are thankful for your interest and participation. Special thanks go to our distinguished participants who have traveled from different countries such as Saudi Arabia, Iraq, Russia, the United States, and Malaysia. We are also grateful for our sponsors for their support and partnership. Thank you all once again, and I now invite Professor Khabal, the Vice President of the College of Medicine, to deliver a welcome address. Thank you.
Merci, professeur Jésus. Donc, mesdames et messieurs, chers collègues, distingués invités, c'est avec un immense honneur et une grande joie que je vous accueille aujourd'hui au centre de formation de la faculté de médecine d'Agadir pour le premier congrès international de la Masterclass d'Andrologie. Cet événement, organisé par le service d'Urologie de l'hôpital universitaire de Souss Massa, en collaboration avec le Global Andrology Forum, réunit des experts de renommée internationale pour partager leurs connaissances et leurs avancées dans le domaine d'andrologie. Nous avons l'honneur aujourd'hui d'accueillir des spécialistes en premier plan, notamment le professeur Agarwal, professeur Pugard, professeur Volpi, professeur Konstantinidis, le professeur Kayan et le professeur Castiglione, et bien sûr notre cher collègue et ami, professeur Ahmed Ziouzou. Le programme de ces 2 jours promet d'être riche et suivant, avec des présentations et des discussions sur une dernière avancée en matière de diagnostic et de traitement de l'infertilité masculine, ainsi que des troubles sexuels masculins, mais des exposés des techniques de sélection de spermatozoïdes, le rôle aussi de l'intelligence artificielle dans les diagnostics, les stratégies de gestion du stress oxydatif, de la fragmentation de l'ADN spermatozoïde, et bien d'autres sujets d'actualité. Je tiens à exprimer ma profonde gratitude à tous les organisateurs et intervenants pour leurs efforts inestimables dans la réalisation de cet événement exceptionnel. Je suis convaincu que les échanges et les connaissances partagées ici contribuent significativement à l'amélioration des pratiques cliniques et à l'avancement de la recherche en andrologie. Enfin, je souhaite à chacun de vous un congrès de plus fructueux et enrichissant, que ces 2 jours soient nos sources d'inspiration et de nouvelles collaborations pour le futur d'andrologie. Merci à tous, bienvenue, welcome et marhaban again.
Merci beaucoup for this introduction. Thank you very much. And now I invite Professor Ali, who is the General Director of the Souss Massa University Hospital in Agadir. Can I speak French?
Merci beaucoup pour ces mesures, d'avoir organisé avec votre équipe ce grand événement du premier Masterclass international en Urologie, et aussi d'avoir ramené des experts internationaux pour organiser cet événement, pour permettre à nos jeunes résidents, à nos jeunes médecins de la région également de bénéficier de cette formation qui va nous servir dans notre pratique en manière de connaissance et de compétences. Merci beaucoup pour l'organisation. Et j'aimerais bien que vous organisez tout à l'heure, à la fin du journée, une visite sur notre future University Hospital, next to the faculty, to visit our hospital, new hospital, it's just near the faculty, pour voir notre service d'urologie, un grand service d'une capacité de 30 lits. Et nous avons 4 salles d'intervention, une salle opératoire, équipement avec un équipement de dernière génération, une salle d'idée à l'endoscopie urologique, une salle d'exploration fonctionnelle également, et une salle d'études aussi, bien sûr, extracorporelle, avec tout l'équipement que vous voulez. J'aimerais bien que vous invitez pour visiter, si vous avez le temps, en fin de journée ou demain, notre hôpital, et je peux être avec vous si vous voulez. Encore une fois, félicitations pour l'organisation, et j'espère que cet événement sera organisé de façon annuelle. L'essentiel, c'est la continuité. Donc, I wish you a good conference. Enjoy your stay.
Thank you very much, Professor Agashani. And now I invite our distinguished expert, Professor Agarwal, to give the welcome address.
Good morning, everyone. I'm not at least familiar with French language, so I apologize. But I can say Salam Alaikum and welcome to each and every one of you to this special masterclass that has been organized with the help of my dear colleague, Dr. Imad Jiazu. I may not have said your last name very well, so I'm sorry, because for American, first name is good. We call Imad, so I always call you Imad. I never learned how to say the last name, but so happy to see so many of you here, and I want to warmly welcome all the guests to this program, and I hope many more will come during the day and join this special program. I also want to warmly welcome my colleagues from many different parts of the world who have come to this master class to teach and to share their knowledge and experience with all of you. Professor Giovanni Colpi, my dear friend for last 40 years, although he is very young, but I always call him very senior person. And many of our colleagues who are here, Professor Garma Pingera, from Austria. Dr. Kolpi is working in Switzerland, but he is a Milanese from Italy, and his colleagues from his hospital, which I will introduce properly in a minute. Professor Selahin from Turkey. So we have some very important figures in the field of andrology from many parts of the world, and I can tell you that the knowledge that we have, the experience we have, could be easily equal to more than 200 years of clinical experience, research experience together with all the people who are here. So what you are going to learn here is going to be remarkable. It is going to be something very special, and I wish that all of you will enjoy this special moment that we have created with the help of our colleague here and his friends who have joined together to put this program together. So without further delay, let me give you some details of the program that we have planned. So this is our plan. We are going to cover so many things which you see here in the learning objectives that we have planned. Well, I think you can read, so I'm not going to read everything, but it's going to cover all the different aspects of male infertility, and then also the male sexual dysfunction. So it is going to be a combination of important topics. Of course, the field of andrology is very broad, and we can take maybe 2 years and still not be able to cover the scratch of everything that is there, but we have chosen some important topics which we believe will be very important for anyone to learn, and especially our colleagues here from different parts of the world who have come. So it is going to be important, hot topics which are something that we would like to share with all of you today. So we have broken the program into 2 parts. One is going to be today, full day, and then tomorrow, all day program is there. So it's a 2-day master class, and you have seen many of our guests. One more guest from Greece is supposed to arrive any minute, and he will be joining, and he has several lectures too. And I'm going to go into the details of these talks in my subsequent slides. Just briefly about me, I am sure that there is not much to describe, but I am the person who has been very fortunate to have so many very intelligent, very smart people who have devoted their time and their experience to come here. So I'm very fortunate that so many of you have trusted me and Dr. Imad to come and give your time, valuable time, to this conference. So thank you very much. I have a presentation which is going to cover advances in male infertility diagnostics, and you will hear some of the things that are part of the learning objectives. The goal here in this master class is to be much more relaxed, with time for people to ask questions, and not be such where we have a very rigid type of structure, because we don't have large number of speakers. So each speaker is going to be able to give time to explain the things according to the way that the audience are interested. So we have information that we are going to share about different aspects of the AI or artificial intelligence and how it is affecting or may be affecting the field of andrology in the next several years. So a lot of things are projected, are not always happening right now, but it is possible that these things will come into the play soon. Here we have our colleague who is a very distinguished professor of urology at Souss Massa University Hospital, Faculty of Medicine. You can see him here, and most importantly, he is an associate professor. He has a PhD in clinical epidemiology. He is our colleague from the Global Andrology Forum, and he has great interest in both male infertility and male sexual disorder, and also in many invasive urological surgery. So you will get to hear from Professor Imad. He will give a presentation on, which is the next slide, I can show you, on the importance of sperm DNA fragmentation testing, and if that particular test add value to the management of male infertility. This is a radical test, and in the field of diagnostic andrology, there hasn't been any such test so far in the history of this field. So there is so much promise, so much controversy, so many problems, but still we are talking about it every day. So this is something that we believe it is important for everyone to understand where we are. Then we have, and these are the things that he is going to be talking, as you see in the learning objectives. He is going to highlight the impact of this test on the management of male infertility and provide a practical solution for how to implement this test in the treatment of patients with male infertility having high sperm DNA fragmentation. So this is a test which is not a diagnostic test, but also a test which really can try to trigger how to perhaps handle the patients who have cases of male infertility where there are high amount of sperm DNA fragmentation and many other associated conditions, failure of IVF and so forth. Then we have our young friend from Austria, Professor Pingera. As you see, he is very smart, and he is, I think I can take 1 hour just talking about him. So I will want you to read so many things that are written here. He is a distinguished reproductive urologist with extensive experience and contributions in the field of andrology. He is a full staff member and senior ward physician in the Department of Urology in the Medical University of Innsbruck in Vienna, in Austria, sorry. And he is also the head of the Andrology and Male Infertility Unit there, and has almost 20 years of clinical experience in andrology. And he has so many different positions that he is in charge of, and we are very lucky to have him as a senior advisor in the Global Andrology Foundation, and he is going to give several lectures today and tomorrow. One of his lectures is on the imaging in male infertility, and these are some of the learning objectives. So you can see the things that Professor Garmer, Professor Pingara is going to be talking about. This is a very important area, so this will be covered during his presentation, I believe, after lunch, I believe, or maybe in the morning. Then we have a young Italian doctor and specialist, Dr. Fabrizio Castelloni. He is a specialist in andrology and an affiliate member of European Academy of Andrology. And you can read, I think, about him. More importantly, he is working along with Professor Giovanni Colpi for more than a year now, and he is performing and learning many of the techniques directly from the master, which is Professor Giovanni. So you can imagine that Dr. Giovanni can select anybody in the world, and he's trusting this person, so he must be very good. So without giving too much details, I'm sure that he has some very good things to tell us, and he is going to talk about the management of oligospenoteratospermia, which is a condition of very poor semen quality beyond ART, which means besides treating these men with assisted reproductive technology such as IVF, are there other ways to treat? And this is, I think, the topic that Dr. Fabrizio is going to tell us how this can be done. In terms of his learning objectives, you can see the things that he's going to discuss, the causes and risk factor, diagnostic evaluation, medical treatment, etc. And so this will be a fabulous talk that we are looking forward. Professor Selahin Kayan, who is here with us, is a professor of urology at the University of Mersin in the School of Medicine in Turkey, where he is also serving as the director of andrology and male reproductive lab. He has a humongous amount of experience in both clinical and research focused on male infertility, erectile dysfunction, and sexual health. And you can see he has a lot of senior positions in both Turkish societies, but also in other parts of the world. He's very distinguished in his career and one of the leading academicians from Turkey. So we are very fortunate to have Professor Selahin here with us, who's going to be giving several talks. He has a talk on the diagnostic assessment of male infertility and what are the current guidelines. And in this talk, he's going to cover many things. As you can see, he will talk about the hormonal evaluation, the genetic test, radiological imaging, what are the guidelines from European Association of Urology, AUA guidelines, ASRM guidelines, and he's going to provide a comparison of the two guidelines. So this will be a very nice talk which he has prepared for us. So we're looking forward to hearing from him. Here we have Professor Giovanni Colpi that you have been waiting to hear for a long time, and Giovanni is what we call a father of andrology that you are seeing. So I believe you are very fortunate. We are all very fortunate to have him coming here because his last visit to this country was 50 years ago, he told me. So this is his second visit after 50 years. So because of Dr. Imad, he decided to come here. So Imad, you are a very lucky man, I must say. And Giovanni is so many things that you are seeing here in his CV. But clearly he is a master of andrology in all respects. So this master class is dedicated to Giovanni, I must say. So please. Thank you very much, Giovanni, for being here. And I cannot do justice to introduce him. I think if you don't know about Giovanni, then you should read on the internet or just look up. There will be a lot of things to know about him. But clearly he is the original andrologist who has done so much for the field of andrology for thousands of patients, not only from his part of the world, but from many other parts of the world. So I think not only from a clinical point of view, but from a scientific point of view, he is clearly one of the most prominent andrologists of this century. So we are very fortunate that he decided to come. He's a very busy man, and he just attended the meeting in the, I think it was in the ASHRAE meeting in which was just finished, and then he flew here. So It was a very busy schedule for him. And he's going to start with the interesting clinical cases in reproductive surgery. This is something that we are doing just for our colleagues in Morocco. This type of program we had not done in the past, but clearly I think we believe this is very, very important to have people who have really distinguished themselves in the field of, in any field, but certainly in andrology, not only to talk about the medical information and laboratory information, but also talk about their surgical cases. What are the most important, impressive cases, the most difficult cases, or the most memorable cases that you would like to discuss, because that really tells you about their brilliance, their intelligence, and how they are managing such cases, which may not be so frequently seen by you, and their unique approach, how they are handling such type of different issues, and I believe these will be fascinating for each and everyone, not only in Morocco but around the world. So I'm very happy with his cases which he has provided in terms of what he will be talking. So this is about patients with non-obstructive azoospermia. I'm not going to read because then I'll be taking an hour of my time, but he has 3 different cases that he will be, I think 4 cases I believe. Giovanni? 4 cases. So each case is going to be different. 5 cases, sorry. So he is very kind to really prepare 5 cases from thousands of cases that he has done, and I think he selected these because these are very important cases, something which he feels are very unique, very interesting, and that signifies his approach to this particular condition. So these are the cases from our colleague Professor Pingara, and you will hear his clinical and surgical cases that he has put together. I didn't put any learning objectives because I think you want to experience what he has to teach you. Then we have Professor Salahin, who has also many cases which he has outlined clearly. This is an oligospermic man with recurrent varicocele, and how are they going to be handled by him. Then this is an azoospermic case with no sperm on primary microtachy, how he is handling this particular case. The third case is on azoospermic case with low ejaculate volume and ejaculatory duct pathologies, how he is really handling this. So these are going to be very interesting with, you may see some videos and actual things which by itself could be a separate masterclass. They are so interesting, but we have tried to package everything in this program to allow you to get the maximum benefit of everything in the program that we have today and tomorrow. So this is a very unique type of program structure that we have created today. This is the program for tomorrow, and we have our speaker from Greece, Professor Charlampos, and I will not try to speak his last name because it is Greek to me. I mean, this is just a pun intended, means that I don't know how to speak very well. But he is a consultant in urology and sexual medicine, and you will get to see him. He is very smart and very knowledgeable, has a lot of clinical and surgical experience in the field of andrology. And he will be talking about the genetic testing for male infertility, which is really an area where there is a lot of people don't understand, because genetics in general is a little bit complicated for people who are not really have learned about it in the medical schools. So I think he's going to discuss what kind of abnormalities are there, and how do you evaluate and how do you really provide the advice to these men? What can you do when you have genetic conditions? Is there things that can be done, or these are just the way that it is, and you can only diagnose and do nothing? So there are things that can be done, and I think he's going to provide us that information. Then we have Professor Colby coming back and giving a very nice talk on the management of non-obstructive azoospermia. And GAF stands for Global Andrology Forum. We have developed our own guidelines and expert recommendations. So this is something that we have recently published, and of course we are going to hear all of that in this presentation by Dr. Kolpi, who has put together the information in a very concise manner with his explanation of the things that are part of the publication. You don't have to read 50 pages of our publication. We will provide it in easy, simple way for you to understand. So this should be a masterpiece lecture that we have. Then we have Professor Charlampos coming back on the management of obstructive azoospermia. What are the controversies and current practice? Here we are going to again go over the cases which clearly have a clear obstruction pathology, and what can be done to really consider whether they should be benefiting by vasectomy reversal or whether there should be sperm retrieval technique. What are the best ways to approach patients with obstructive azoospermia? I have a lecture on the antioxidants in male infertility, expert opinion based on a study that we conducted of about 1,300 physicians from 80 countries as a part of a survey, global survey, which we published in a high impact journal. So I'm going to combine those findings with some of the things that are part of my presentation. So I'm not going to spend a lot of time talking about it. I will discuss this tomorrow. But we have Professor Selahin, who's going to go into the surgical treatment of varicose, and he's going to talk about the recommendation of the Global Andrology Forum expert panel. And you will be surprised, although we started this forum only 2 years ago, but we have created some amazing guidelines for physicians around the world. And these are all published in peer-reviewed journals. So I think what you are going to hear are part of peer-reviewed publication from our own panel of physicians and researchers who are working hand in hand every single day. So this is going to be a wonderful presentation from Dr. Selahin, where he's going to talk about so many things that you see here in terms of his learning objectives. We have another presentation then tomorrow by our young friend Professor Fabrizio on the role of hormones in male fertility landscape. So this is part of the series of talks under the management of male infertility, where he's going to talk about some endocrine concepts. What are the hormonal? How do you really use the hormonal assessment in infertile male? Indication for hormonal therapy. This is an area which is really poorly understood. A lot of people are being treated with various types of hormonal treatment. Many of those treatments are considered empirical, and there is not very strong scientific evidence that everybody agrees, but nevertheless they are being used. So I think it is important to understand what is the state of evidence, and when you will be treating them, and when you probably find that those treatments are not going to work. Then we really change to erectile dysfunction or male sexual dysfunction. So the rest of the day in the afternoon tomorrow are going to be devoted to the second aspect of andrology, which is male sexual dysfunction, with a lecture from Professor Charlampos on the practical management of erectile dysfunction and what is the latest update. So he's going to cover this very large area of erectile dysfunction by providing the key update for all of you to really understand the state of the play at this time. So I think this will be not only a historical aspect, but also provide the latest update regarding the treatment modalities such as shockwave therapy, platelet-rich plasma, stem cell. And this is part of a study that we just published, and hopefully you will get to hear from him. Then we have a lecture from Professor Pingera on the strategies to manage premature ejaculation, and his presentation on this subject is really amazing. I had the chance to look at it, and I'm going to tell that we are not going to share because you need to be here tomorrow. So it is important that we don't tell you now, because if you see it, then you will not believe, but you have to come tomorrow to see it. So now I want to briefly introduce to you what is this name called Global Andrology Forum. What is this animal? Why is it everybody talking about it here in this meeting? Introduced by Professor Juju. So it is a organization which is now under the umbrella of Global Andrology Foundation, a non-profit organization which was started about 2 years ago, and essentially something that we have now close to 800 participants from 90 countries, all together with the promise of really working in the field of andrology. So whether you are a clinician or a researcher, if you have an interest to really learn about andrology, you want to work in the area of andrology, it is a virtual organization, and I think I will explain more in terms of our mission to conduct the highest quality of research in many different formats, whether it is a systematic reviews, whether it is an editorial, whether it's a global survey, whether it is different types of narrative reviews, by conducting workshops, conducting master classes, webinars. So our goal is to really bring together and build the knowledge base in the field of andrology. And why are we doing that? Somebody will say, what is so special about andrology that you have to create this group? What is so special about andrology is that it is the most neglected field in the area of medicine, especially in men's health. Although problem of infertility affects over 300 million couples around the world, maybe more, but most of the burden of infertility comes on the shoulder of women, on the females. And in many places, men is never considered a source of problem. They are never investigated. There is never any type of focus on examining, understanding what could be a problem. And the burden of infertility is squarely on the shoulder of the female partner. And in some cultures, I have heard and have seen that people who are, and maybe Giovanni will know because he has a lot of experience, who are 80-year-old, 70-year-old, will frequently change their woman, a partner, marrying new or younger woman because they say that she is not getting pregnant, and without bothering to see whether they are even making a sperm, and they may be completely azoospermic, but they are easier to blame the woman and try to have more partners, but they will fail, of course, because they have not really had any kind of examination of their own. So, long story short, I believe that the field of andrology is highly neglected, and most of the treatments, or a lot of treatments, are highly controversial. Even the most common procedure for a common pathology such as varicocele, still people are thinking this is just a useless procedure, there is no science, there is no evidence to do the surgical repair of varicocele, that it doesn't work. And many of the gynecologists, I hope there are not too many who are going to get upset, don't believe in varicocelectomy or varicocele. They think it's a figment of imagination of urologists, and there is nothing like varicocele. We can make every woman pregnant, and we don't need men. We can just get the sperm, and the woman can sit at home, and we can take care. So I know we have people from many parts of the world here, and maybe they will have some idea that what I am saying is probably true in their own experience of practicing this field. But I can tell you that certainly there are so many types of problems of andrology, andrological management of infertility, which lacks solid evidence. And because of that, the treatment of infertility, even for half of the men, is considered as empirical, because we have no clear diagnosis, no clear pathway for treating those men. So there is so much to learn, so much to develop good science and evidence that there is a need for an international association or organization which is really devoted to building the good science behind the field of andrology. And this was really why we created this group. It is completely focused on that, and I think for doing this, we don't need a lab, we don't need a surgical center, we don't need a physical laboratory, because we are now in a different environment where you can do everything virtually. And building the evidence requires your mind, your brain. It doesn't require always, because there is so much evidence out there, how to put it together, how to really build the case for your condition or your treatment is most important. We are very fragmented, and to put it all together requires very good scientists, good clinicians to come together and to work together. So we are completely apolitical, means we have no political interest, we have no regional interest, we are not really looking for any kind of achievements. We are completely free. Anybody can join. Of course, you have to meet our criteria for joining, and we have opened the doors for practitioners and researchers from all over the world to join. And we are very fortunate that our growth has been tremendous, from 0 to now 800. And these are highly selected individuals who are really interested in the area of andrology. They are not necessarily all surgeons, and but there are many IVF practitioners, there are some nurses, there are embryologists, biologists. As long as they have an interest to understand and to learn about male aspects of reproductive disorders, those are the people that we are really interested in. So our vision is to create a global collaboration of clinicians and researchers to promote scientific excellence in the field of andrology. And this really is our goal. And I think we believe really in what we are doing, because we are really passionate about our goal. And you can see we have people from all parts of the world. Some are more represented than others, but we also have how many from Morocco? 7. I think we have to do better. We have more people from Morocco here who can join. So it is now, I urge many of you who will listen to the program for the next 2 days to see if you benefited and you would like to join, like Professor Iman, you are more than welcome. So these will tell you the type of specialists who are joining with us. We have many different classes of people, you can see. This is our group of management, as you can see. We have a lot of people who are advising us and guiding us to work together. And these are our people who are from all different parts of the world. and you can become a gap member. The application is very easy. There is no fee for nothing. So whether you take a course, whether you do training, we provide complete training, and so many types of programs that we are running. So it is clearly, I think, a program which is completely free. You can go to the website www.globalandrogyforum.com, and there is an application that you can fill out. It will take you 15 minutes, upload your CV, and it will go through our interview process. Lastly, I need your help, the audiovisual person. Please come over to help me with the last slide. We have a song that we have written about our organization, and I want to play for 1 minute.
To be found in improving health and wellness for our fellow. This is a song about the Global Andrology Forum, empowering men's health, shaping the future together, written by ChatGPT, performed by. This is a song about the Global Andrology Forum, empowering men's health, shaping the future together, written by ChatGPT, performed by Neil Agarwal. Take 3.
This is my younger
From all nations gather around with a common goal to be found, improving health and wellness for our fellow men's success. Global Andrology Forum, bringing hope and healing to the world. For every man in every land, together we take a stand. Experts from near and far share their knowledge without advancing science every day, making life better in every way. Global Andrology Forum, bringing hope and healing to the world. For every man in every land, together we take a stand. And let's work together side by side, with compassion, love, and pride. For the future, let us strive, make a difference, come alive. Global Andrology Forum, bringing hope and healing to the world. For every man in every land, together we take a stand. For every man, you'll find a cure with knowledge, strength, and love secure. Global Andrology for every man, for every woman.
Thank you very much, dear Professor, after this brilliant presentation on the Global Andrology Forum. And after this happy song, I think it is time for refreshments and the coffee break. Thank you very much.